Good morning, everyone. I want to thank everyone for participating in our first ever public policy seminar over GoToWebinar. We're at least excited that we could talk or offer information to people over the web given the COVID epidemic. I hope everyone's staying safe and healthy. Here at the ARC, we continue to work on public policy issues every day related to the COVID epidemic or pandemic and other issues such as direct care wages and the HAB waiver final rule, and of course the budget that we'll all be working on for the next couple years given the time that we're living in. I want to give a special thanks to Betsy Weihl and Christin Nohner, who are our presenters today from RWC Advocacy. And I'd also like to thank Emily Mullins and Courtney Trunk, who are doing all the behind the scenes work to make this possible. Again, I hope that the information we provide today is helpful, and I hope to see, quote unquote, you all next week for our next presentation. Thank you.
Good morning. This is Betsy Weihl. I am happy to be joining all of you today, although disappointed not to see your faces. This event is one that I look forward to every year. I'm glad we have this alternative way to meet and visit with you, but I certainly look forward to seeing everyone in person again someday soon. As Sherry indicated, Christin Nohner and I are here from RWC Advocacy. Our firm has been privileged to represent the ARC Michigan for many years and to be a partner in the ARC's public policy agenda in the Michigan legislature and in other branches of the Michigan government. This is our opportunity every year to give you an update on what the political landscape looks like and what some of the legislative matters being discussed look like, and then particularly to share some of our thoughts about how all of you can be the wonderful advocates that you are, and then to take any questions or observations that you might have based on what you're experiencing either in your Lansing advocacy or locally. So again, thank you to the ARC for our partnership. Thank you to Sherry, Emily, Courtney for assisting with the technology that allows us to be with you today. With that, I am going to introduce Christin Nohner. Many of you know Christin. Many of you don't yet know her, but Christin is a new member of our firm. She has brought to us just a wealth of political expertise and policy expertise, and we are so grateful to have her as part of our team. And I know that you will continue to find Christin to be an excellent additional resource from RWC Advocacy. With that, Christin, I will turn the presentation over to you, and then I think we'll reconvene as a group at the end of your presentation for any questions.
Thank you, Betsy, and thank you to the ARC for the opportunity to present today. As Betsy said, my name is Christin Nohner. I am new with RWC Advocacy as of January of this year, which now kind of feels like a lifetime ago. But prior to that, I was handling government relations for the Michigan State Medical Society, and prior to that, I was with the Michigan Academy of Family Physicians. Before I moved to Michigan in 2012, I was working on Capitol Hill as a legislative staffer, both in the House and in the Senate. And so I have kind of a perspective on advocacy, both inside and outside the legislative arena, having now being an advocate, and then having been on the receiving end of advocacy as a staffer. So with that, I'm going to kick off our presentation, and we are going to start things off with giving you kind of a landscape picture of what advocacy looks like in Michigan, both in the regulatory environment and the legislative environment. So with respect to the executive branch, we obviously have the Office of the Governor. Our governor, as you all know, is Governor Gretchen Whitmer, elected to office in 2018, assumed the position in 2019. Spent a lot of kind of the first few months sort of staffing up her cabinet positions, her agency staff, and really getting their feet under them as a new administration. And I'm highlighting here the agencies that the ARC typically works with, the Michigan Department of Health and Human Services, first and foremost, probably for most of the issues that the ARC touches, the Behavioral Health and Developmental Disabilities Administration within MDHHS, and then of course the Medical Services Administration, which oversees the state Medicaid program, also within MDHHS. And then also I highlighted the Michigan Department of Insurance and Financial Services and the Michigan Department of Education, which sometimes cross over, some of our issues kind of cross over there. So because we work mostly with the Michigan Department of Health and Human Services, I wanted to just highlight the leadership team there, just to kind of familiarize yourself with the players and who's sort of the people leading the governor's health agenda at the state, and who are the people who ultimately your advocacy within the regulatory sphere, at least within the issues MDHHS touches, who are the people you want to get to know and influence. So Robert Gordon is the director. He assumed the position in 2019, as I mentioned. The governor was staffing up her cabinet positions. Robert Gordon came in from out of state, as a number of the people within MDHHS did, to bring kind of an outside perspective and infuse some additional vision and knowledge from other parts of the country. Elizabeth Hertel is the Chief Deputy for Administration. She's kind of been in the Lansing arena inside the legislature and the private sector and in the public arena as well. She's a well-known person in Michigan. Dr. Janae Caldoun is the Chief Medical Executive, and Dr. Caldoun has obviously in the midst of COVID-19, she's really raised her profile. If you catch any of the governor's press conferences, she's always kind of the prominent voice of what the data and science are behind the COVID-19 response, and able to speak to kind of the medical perspective alongside the governor in the public arena. So she's probably, at least in my experience, since I've moved to Michigan and been involved in this work, she's the most public chief medical executive that we've ever had, but it's probably to no surprise given the crisis that we are facing, the public health crisis we're facing. Alan Jansen is new to the Behavioral Health and Developmental Disabilities Administration as Deputy Director, not necessarily new to the space, but new to the role. So he will play an influential role in that agency. Kate Massey, Senior Deputy Director for Medicaid, leads all things Medicaid. Also someone who came from out of state, not necessarily a bad thing, but someone who's kind of bringing a different perspective. And it's helpful to kind of know the background and the biographies of some of these individuals and know kind of how they think. And we'll relate some of that back to our advocacy discussion as we move along. And then Sarah Esty, Senior Deputy Director for Policy and Planning, assumed her role in 2019 as well. And I believe that she is going to be presenting in one of these webinars in the next couple weeks, so you will be hearing from her. So I wanted to spend a little bit of time on the legislative branch. We have 148 elected members of the legislature, 110 representatives and 38 senators. We have a year-round full-time legislature. It's a 2-year session schedule, and we're actually in the 100th legislature right now. So it began on January 1st, 2019, and will end this December 31st, 2020. And so I want to kind of emphasize that I do say full-time. but being a legislator doesn't just mean attending legislative sessions and voting on proposed laws. State legislators also spend a lot of time in their districts assisting constituents, studying state issues, campaigning, fundraising some of the time as well. And so the full time really relates to that constituent work back in the district, but also their time in Lansing, which is usually a Tuesday through Thursday, if they're in session, a Tuesday through Thursday session schedule. But they are full time in that they do look a little bit more like Congress. And I wanted to share kind of a map of how Michigan compares to other state legislatures, because I find this really interesting. Michigan is, according to the National Conference of State Legislatures, so this is sort of their analysis. They put Michigan in this green, dark green category, along with California, Pennsylvania, and New York. And how they kind of categorize that dark green category is legislatures that spend 80% or more time doing the work of legislating or constituent work. So they typically have large staffs. They typically don't have other jobs. I say typically, there's certainly exceptions, but they can generally make a living as a lawmaker. And so Michigan is really only one of four other states. Three other states, one of four states that has that dynamic. And then they have full-time light, which you can see some of our partners in the region fall under that category. And so they also spend more time than other states legislating, but not as much as those dark green states. So again, you would kind of compare the dark green states similar to kind of congressional schedule. They're very, very busy, a lot. So the interesting thing that I also wanted to point out is these gray states, which is the vast majority of states. And according to the NCSL, the legislatures in these states typically spend more than 2/3 of a full time being legislators, but their income from legislative work is usually not enough for them to make a living out of it. So they typically will have other jobs, and they have an intermediate kind of size staff. So not as robust as the Michigan legislature or some of these other green states. And that's where the vast majority of states in the country kind of fall. So Michigan does have term limits. We have pretty stringent relative to other states term limits. The state house, it's 3 terms, 2 years each. 2 years each. State Senate, 2 terms of 4 years each, for a total of 8 years, and a total 14-year lifetime limit. So the progression typically you'll find is someone starts in the state house and fulfills their term there, and then they'll work up to the state Senate and get elected in the state Senate if the timing is right for them to assume a role there and fulfill that commitment. Sometimes every once in a while you'll get a state senator who will actually go and become elected to the state house. So it's not necessarily a natural progression that you go to the House, the Senate. We do see examples of people going from the Senate to the House. Representative Rebecca Warren from the Ann Arbor area is an example of that. She was previously a state senator and is now a member of the House. But many, not all, will toggle kind of back and forth and try to fulfill their legislating commitment in both chambers if it's feasible for them to do so. But the term limits were approved in 1992. And as I mentioned, Michigan has the strictest, among the strictest in the nation. And there are really some benefits and pitfalls to that. I don't want to wade in too much in this debate, but just to kind of highlight, some of the different arguments over whether term limits serve Michigan or not. Some of the benefits of term limits people highlight are, you look at Congress and you have people in Congress for decades, to the point that they're in their, mid-90s and they're really not able to fulfill all of the responsibilities that have been placed on them as a member of Congress. And people kind of bristle at that a little bit, or you develop this robust incumbency that really no one can overcome, and no one can really challenge you unless you really do something wrong. And I think people really want to see fresh infusion of perspective in lawmaking, and I think that's part of the. I know there's lots of arguments for term limits. That's just one I'm highlighting. I have to say, I think there's a lot of pitfalls to term limits that people share, myself included. The main problem, or one of the problems, I guess I should say, not the main problem necessarily, but one of the problems is really experience. And in Michigan, you do find that we have lawmakers, not that they aren't intelligent and capable and hardworking, but they assume committee positions that take on a lot of responsibility, manage huge budgets, lots of implications for Michigan citizens, and they haven't necessarily been legislating for more than 9 months. So there's certainly some benefits and pitfalls to term limits, and I know that there's ongoing kind of dialogue and debate over whether it's something that we want to continue in perpetuity. So now I want to spend a little bit of time on the political composition of the legislature. We do have 22 to 16 Republican majority in the Senate. The Senate Majority Leader is Mike Shirkey of the Jackson area, and Senator Shirkey will be Senate Majority Leader through 2022. The Senate Minority Leader is Jim Ananich from the Flint area, and Senator Ananich will maintain that role until 2022. In the House, we have 58 to 52 Republican majority. We have House Speaker Lee Chatfield. It's a young 32-year-old guy from Petoskey. He was actually elected to the House when he was 30, which is pretty impressive. And we have Christine Gregg, the House Democrat leader from Farmington Hills. Now, both Speaker Chatfield and Democrat leader Gregg will be done at the end of this year with their leadership positions, and their time in the House will also be done. So we'll talk a little bit more about elections in a second. I also wanted to highlight some developments since the 2018 election. As many of you know, women assumed new government roles in historical numbers after that election, and in the legislature, 42 women are now in the state house and 11 women are in the state senate. And so we have now around a 35%, a little bit more percentage of women in the legislature, putting Michigan kind of the middle of the pile there among states, but certainly better than where we were going into 2018. And we really see that women taking on increasing roles going forward. If you look at some of the people running in this next cycle, more and more women are kind of stepping up to that challenge, which is very encouraging to see. We have a total of 64 women elected across all statewide races in 2018. As I mentioned, 53 in the legislature, but also we have women in the Supreme Court. Chief Justice is a female. U.S. House, many women elected to Congress in 2018. Senator Debbie Stabenow was reelected in 2018. And then our Attorney General, Secretary of State, and Governor, obviously all women. And then the governor, while not an elected position, she did appoint a number of women in cabinet roles. So the Department of Insurance and Financial Services is run by a woman, and the Licensing and Regulatory Affairs Agency is run by a woman. And a number of minorities are taking on leadership positions all across state government, and that's really been a trend that took off in 2018. So 2020 election, we do have an election coming up. November 3rd, 2020 is our general. We'll have a primary in August, and it's a presidential election year. So we will expect more turnout, which makes it a very consequential year for a number of reasons. All the state house members are up for re-election, as I mentioned, every 2 years. So they'll be up this year. There'll be no election for the Senate or the governor until 2022. All of the members of the U.S. House are on the ballot, and then Senator Gary Peters, our U.S. Senator, is up for re-election, and he does have an opponent, John James. In terms of ballot initiatives, I don't believe anything is finalized yet, but I know that there are some issues percolating, potentially going to make their way on the ballot around abortion and LGBTQ discrimination. And this is a good year potentially to get initiative on the ballot to vote on, because as I mentioned, there's higher voter turnout. And absentee voting is going to play a really prominent role in this election cycle due to COVID-19 and probably some of the riskier times we're going to face in the fall compared to what they say now. There could be a resurgence of COVID-19 as the weather gets colder again, and I know there's varying opinions on that, but I think all agree that if we can mitigate more people going to the polls by allowing absentee voting, which we now allow for no reason in Michigan, that we should do that. So currently the Secretary of State is mailing applications to vote absentee in that effort. The only thing I wanted to mention here is that the Democrats in the House do have a chance to flip it. They have about, I believe 5 seats they will need to flip to take the majority. But they only have 5 targets right now based on some Politico's analysis of kind of the landscape. And I'm going to talk a little bit more about gerrymandering and kind of what these these areas look like and why it's so hard for the Democrats in particular. But this is a consequential year for them, and a lot of it's going to rest on how well the president does. So if President Trump going into the fall, his poll numbers have improved, the economy is experiencing growth as some are predicting, if COVID-19 is contained and we're on a better trajectory, people are just feeling a little bit better and more at ease, the Democrats are going to have a little bit more trouble. If the opposite happens and the president's poll numbers aren't doing very well and the base doesn't necessarily feel energized, the president's base doesn't necessarily feel energized, and people are a little bit nervous about the state of the country, you could see more opportunities for Democrats. So redistricting. Republican majorities, as I mentioned, Republicans they took control of the House in 2010, and they had control of the Senate at that time as well. And they, at the time, were able to redraw maps, controlling the redistricting process. So there was a lot of backlash over that, and I know that it's still somewhat of a contentious issue. So I don't want to color it too much with my own commentary, but all I'll say is in 2018, voters approved Proposal 2 that allowed for the creation of an independent Citizens Redistricting Commission. And a number of applications went out, and there was a public application process, and over 6,000 people applied to sit on that commission. And I believe the next step is to kind of winnow those applications down to 200 by the end of June. And the final selection of commissioners, about 13 commissioners divided up equally by party and independents, that will take place in August. With maps redrawn in 2021 and with new maps for the 2022 election. So I wanted to run through the ARC's key policy issues. Behavioral health integration is a big issue for the ARC, and it's become even more prominent because of some of the interest within the Department of Health and Human Services to move forward on their own proposals around integration. And so I'm not going to go into any details here necessarily, but this is kind of an example of a standing policy platform, that the ARC has, and needing to use advocacy to influence and shape what another party might think. In this case, a department or staff within the department might think how something needs to evolve. So behavioral health integration is a big issue right now. The ARC has been embedded in that process of kind of deliberations around what that looks like. I think that will continue to those conversations will continue for the next few months, at least. Direct care worker wages. This is another issue that's very important to the ARC, and this has really been shaped by COVID-19. I think Sherry kind of alluded to that. As so many things do with policy, you have an organization has a platform or sort of an agenda of things you want to accomplish, and then something swoops in and kind of changes the trajectory of how you're looking at something and how you're working on it. And so direct care worker wages is one of those issues that in a good way, it's really, the profile has been raised in the midst of COVID-19, and it's garnered the attention of the legislature and the executive. And so the ARC is going to kind of continue to be involved in shaping what that looks like, not only now in some of the proposals that are percolating, but continuing that wage increase into perpetuity. Discrimination in medical care settings. This is a good example of kind of a foundational principle of the ARC being applied to kind of a current issue that arises. And again, COVID-19 really caused a lot of all of us and organizations especially to kind of have to adjust to their previous plans of how 2020 was going to go. There was some concern that that certain populations would be determined to be not suitable for certain medical care, and that there were going to be judgments about a person's relative worth, and the ARC really, among other stakeholders, really pushed to ensure that the state's public policy was clear that there should be no discrimination in determining who gets medical care in a crisis. And COVID-19 in particular was kind of the driver of that discussion, that really important discussion. So there is an executive order that was just extended, kind of reaffirming the state public policy around preventing discrimination in medical care settings, and requiring that providers take all necessary steps to ensure non-discrimination in the policies that they're putting together within their hospital walls or their facilities and their offices. The Medicaid budget, this is kind of a cyclical issue for the ARC anyway, but it's going to be front and center of the policy work that the ARC does this year, in particular because of the really catastrophic cost pressures that the state is facing amidst COVID-19. So Medicaid is always something that the ARC advocates for, holding harmless. Now more than ever, I think it is an entitlement that people that qualify for are entitled to receive these services. But given that we're in a public health crisis, I think it's even more critical now than ever that we hold that Medicaid budget harmless to the extent possible. And I know there's so many things that kind of go into how that happens, federal support and whatnot. We'll talk a little bit about that. But that is going to be really key for the ARC's policy platform going forward. So these are just some of the current issues before the legislature, the fiscal year 2020 budget, the fiscal year 2021 budget, and making not only adjustments to the current fiscal year, but reevaluating what the plan is for the next fiscal year. And I'm going to talk more in depth about that in a minute. The challenge to the governor's executive authority, I think the temperature might have been turned down a little bit more on that given that the governor has lifted her stay-home order. She's relaxed a number of restrictions that she had put in place, and there was just a lot of angst among the legislature that they didn't have a voice in that process, and so they did challenge her in court on her use of executive authority and the statutory and constitutional authority that she was citing in taking the actions that she did during the COVID crisis. That court case is still kind of underway. I guess I should say the Court of Claims ruled partially in favor of the governor, and the House and Senate Republicans are appealing that ruling. They were asking to take it to the Supreme Court, where it ultimately probably will go and bypass the Court of Appeals. But it sounds like the Supreme Court is going to require them to go through the appeals process. So I'm not a lawyer. I just kind of follow things, as a layperson would. But that's been kind of an interesting dynamic to kind of watch, because it does have, depending on who wins out, it will have longer term implications for executive authority in Michigan. And the other issue that is really front and center for both the legislature and the executive branch is the COVID-19 response. So we've had some appropriations measures pass, some in March, right as this was breaking, kind of immediate relief funds to get out the door, that was passed with pretty non-controversial, expeditious debate. And then since then, there's been some debate around some federal appropriation money and how we want to allocate that. And there's a little bit more debate between the legislature and the executive on what that looks like. Codification of executive orders is sort of been front and center in the legislature. They've been debating the merits of various issues behind some of the executive orders. For example, immunity for healthcare professionals is one, and there's just been a number of issues that have kind of bubbled to the surface in the midst of COVID-19 that the legislature has taken a closer look at. And then I just wanted to talk very briefly about the genie in the bottle effect that we're likely to see here. So I talk about this kind of in the context of healthcare. We had unprecedented relaxation of healthcare regulations, from certificate of need to telemedicine, and this is behavioral health and physical health, telemedicine, scope of practice, licensure, and it's really going to reshape how healthcare is delivered in Michigan and across the country. And it's really hard once you kind of deregulate all these things, although it's for a temporary time period. Putting that all back is not realistic. And I know that the legislature is already sort of thinking about, well, what deregulation actually worked? Telemedicine, how can we expand that, in a way that's safe and really kind of get that off the ground even more so than it was before. And it really was a tipping point for a number of these issues that were already kind of teetering on the edge. It was just kind of that push that they needed to get off. I think of telemedicine as kind of an example of that. So fiscal year 2020 and 2021 kind of goes without saying that there's really catastrophic impact to the budget from COVID-19 for both fiscal years. The Consensus Revenue Estimating Conference, which generates sort of official revenue estimates for the state budget in January and May of every year, they convened on May 15th, and the economists from around the state that get together and kind of give their projections, they all had kind of a consensus around a few numbers that kind of painted the picture for the state pretty quickly on where we were heading. And everyone, I think, had an idea of where we were, of how deep our hole was, but the CREC kind of crystallized that. So For 2020, we have a $3.2 billion revenue shortfall. In 2021, we have a $3 billion revenue shortfall. And if you look at a $25 billion state budget, that's a pretty big hole to fill. And we did have some money on the balance sheet. We do have a rainy day fund. We have some other tools we can tap into potentially, but the cuts that wouldn't be necessary if we didn't have any federal money, or if we didn't have any revenue initiatives or any plans to increase revenue, are going to be pretty sizable, and by many opinions, really not palatable, not really realistic if you're going to be able to continue to deliver critical services to the state. So there's still a lot of debate over what's going to happen with our budget in both fiscal years. Right now, the Constitution requires that the governor issues an executive order reducing expenditures for 2020. And so we're sort of waiting on the legislature right now, or sorry, we're waiting on the governor to ideally work with the legislature, because it does have to, the executive order would have to pass the House and Senate Appropriations Committees. Ideally, we're waiting for them to kind of have a kumbaya moment over what those reductions look like. And the governor has kind of said, and I'm sure many of you have seen this repeated publicly, that we really need that relief from the federal government because these cuts are just going to be too deep. So there's this game of chicken a little bit. The legislature doesn't really want to suggest the deep cuts that are necessary. The governor doesn't want to suggest the deep cuts, but there are internal conversations going on, about what this might look like, and we'll kind of know more in the next few weeks. There is a statutory deadline of July 1st, 2021 for the legislature to deliver a budget to the governor, and that may still happen if it's sort of a half-baked proposal with placeholders, or there's some kind of I guess shell that they're able to provide, and that's just some people's opinion, but my personal opinion is that they'll try to do as much work as they can on the budget before July 1st, and then there is going to be another consensus revenue estimating conference at the end of August, early September, and by September they'll have kind of a better picture of where we stand as a state, not only with our tax returns and kind of knowing what our revenues look like a little bit more clearly, but also what kind of federal relief we have and how our economic recovery is going. So I think it's pretty fair to say that the fiscal year 2021 budget discussion will probably bleed into September. We do operate on a fiscal year, October 1st to September 30th. So they have until September 30th to wrap that up. So lots still to come on the budget. Really just hoping that we have more guidance from the federal government on the flexibility within the dollars we have already been appropriated to us, and then hopefully some additional stimulus. This is just a snapshot of the budget bills that are, and the shell bills that are moving through the legislature that will ultimately house the final budget. It will either be House budget bill or a Senate budget bill, and that will all kind of be fleshed out in committee. So with the remaining time we have left, I just wanted to discuss your role as advocates, and the following part is kind of broken down into two: organizational advocacy and individual advocacy on behalf of a cause, and in this case, the mission of the ARC. So, it's really common for organizations to kind of have an extensive policy platform and kind of, foundational principles that they live by. And it's not realistic that you're going to accomplish all of those goals in one legislative session. So identifying 2 to 3 key priorities every legislative session is really important, just to focus that energy and time and resources on those key priorities. I can tell you that even the most innocuous issues that you would think would just fly through the legislature, no problem. There's certainly exceptions, but generally there's a lot of work that goes into getting them moving, getting them, the champion that you need and the chairman to get your attention, to get their attention, and the leadership to get their attention. There's a lot of work that goes into that. So it's really important to kind of focus all of your energy on 2 to 3 key priorities. And deploying a diverse strategy is also important. We ran through the players in the legislative and regulatory environment. So, trying to discern, is this a policy issue that's, just going to go through the rules process, or is this a legislative issue? Either way, if it's a legislative issue, you're going to want to talk to the governor's office, but making sure you kind of have a comprehensive approach depending on what your goals are. So plan offense and anticipate defense. I think COVID-19 is a great example of, you plan your offense in the start of a legislative session and you never know what you're going to play defense on. Sometimes you do, but many times you don't. And you have a new lawmaker who all of a sudden has a passion for something that really conflicts with your policy agenda, and they're really spearheading that. They have leadership roles and they're really trying to drive that forward. And you find yourself playing defense more than you thought you would. So it's really helpful to be nimble as an organization and anticipate, allow for that time to play defense on certain things. Sometimes defense, unfortunately, can consume all of your advocacy bandwidth for a year. I've certainly been in that position. And you want to be proactive in your advocacy agenda, but you don't always have control over the process. You don't have control over the process. So being able to kind of react accordingly. Be both strategic and properly timed, kind of strike while the iron's hot. You'll find that in election years in particular, and if you're talking about the House, they're a little bit more sensitive and vulnerable to controversial issues as you get closer to an election. They tend to kind of shy away from anything that they don't want kind of front and center as they are running for re-election. And because they run every 2 years, they're just a little more sensitive. So election years, and as you get closer to an election, it's a little bit more challenging to get something across the goal line that is controversial. You really want to reserve that time for kind of the start of a legislative session. You'll find a flurry of activity in those first few months of a legislative session, and usually the first few months of even election year, and then things will kind of start to wane a little bit. So thinking about your strategy also in terms of timing, what makes sense when. If it's a good election year issue, it might be a really good time as you move closer to the fall and election year to push for it, but just thinking through those things. And then establishing short-term versus long-term goals. Kind of as I mentioned, most organizations have their long-term goals and expectations, and then you need to have your short-term kind of based on the political landscape and what issues are favorable for that particular legislature. So you might have a bunch of newly elected legislators who lean a certain way politically that doesn't align with your agenda, and you kind of again have to kind of adjust your short-term versus long-term goals based on that and your expectations. I love this quote. Politics is the art of the possible, the attainable, the art of the best. So much of it is you're not going to get everything that you want all the time. And incremental change is really what we're going for when you're talking about big sweeping policy changes. But being part of the process and influencing and giving your feedback along the way will help with even those small steps. So it's really important to keep in mind. I think advocacy can be discouraging because you go through a whole cycle and you don't feel like you got anything big accomplished. But so much of it is just getting what you can done and making that incremental progress. Effective messaging is really important with successful advocacy. You walk into a Democrat lawmaker office, you're probably going to have a different message than if you walk into a Republican lawmaker office, even if you're talking about the same issue. You might want to approach it from different ways. They might have different values. They might not. You know, I don't want to pigeonhole Republicans and Democrats necessarily. It can depend on the lawmaker. But you know, you want to think about who your audience is and tailor your message accordingly. Activate your grassroots. You know, a really shining example of grassroots advocacy for anyone who was following it was the Counselor Scope of Practice bill last fall. It was unlike anything I'd ever seen. The bill was pretty much dead on arrival in the House, and the chairman of that committee where it was referred to had no interest in bringing it up. And there was some dynamics that I won't go into necessarily with the licensing regulation agency. And the counselors started to mobilize, and they had 1,000 counselors outside of a LARA committee hearing, and they had 1,000 counselors in the halls of the legislature and in hearing rooms. And that bill moved faster than I had ever seen a bill move that, you know, was previously highly contentious. It flew through the House, it flew through the Senate, was signed, was just a victory by most accounts, except for the handful of people who had some issues with it initially. And it really was a shining example of what grassroots can do. And I think that I don't know if we'll see another one like it, you know, in the near term. It really was a cool development. If you're just kind of that cynical person about advocacy, it was cool to see that grassroots can do the trick too. Identify district champions in your organization. You know, those folks who can speak to you know, their lawmakers and who are good messengers for your issue. Obviously, you know, individuals with lived experience are the best advocates, and I'll talk a little bit more about that. But you know, organizing site visits and then you know, trying to identify your legislative champions are really important in that grassroots advocacy. Meet with lawmakers, that's kind of obvious, but it's not always followed through, and that consistent touch point on issues is critical. So you can meet with a lawmaker about an issue, and they'll then meet with 500 other people about 500 other issues, and they'll, even though they thought that what you had to say was important and you deliver your message well, you know, that it could be lost in the noise. So to kind of continue that that loop, and I'll kind of talk about this in the individual advocacy side of things as well, that's really important. Testify before committees. This is really important for organizations just to increase your public profile. You know, get a whole committee of lawmakers to see you, to understand, you know, who your constituency is and what you stand for. Testifying before a committee is a really good opportunity to do that. And again, persistence is so critical to successful advocacy. So this is a really beautiful and inspirational mission statement. I was reading this last night, and you know, I think before and in the midst of doing advocacy, it's always important to kind of go back to what is our mission, what are our values, and how do we kind of further our agenda through the lens of that mission, and always remembering kind of why we're doing the work that we're doing. I've just always found that advocates who have a passion for the subject matter and channel that passion effectively are the best advocates. At the individual level, just running through some kind of advocacy 101, and I apologize for those who are really seasoned advocates. You probably know this like the back of your hand, but it's not always obvious. So preparing for a legislative meeting, you know, get to know your lawmaker, and really, even if you aren't going to Lansing to meet with them, it's important to know who the member of your House representative is for Michigan, your Michigan Senate, Michigan Senator, your member of Congress, and you know, the Michigan senators and all of the elected officials. Kind of understanding the landscape and who's representing your area is really important. So what's their biography, their political party, the issues that they tend to champion, and their committee assignments. A lot of times the committee assignments will kind of go hand in hand with the issues that they champion. If you sit on the agriculture committee, you're generally a little bit tend to lean towards those issues and caring about wanting to work on those issues a little bit more. If you sit on health, same thing. So, if they are on a committee of jurisdiction over your issues, odds are they probably have a passion for it, and you can kind of tap into that. District and election, the election process, particularly with members of the House, as I mentioned, really can influence the members who are up for re-election and are kind of sensitive, might be sensitive to a controversial issue that you're advocating for. If it's non-controversial, if it's kind of motherhood and apple pie, that's kind of a different ball of wax. But if it is a controversial issue or something that's going to be kind of hard to move forward, and they have a contentious election, kind of understanding those politics that might be influencing their thought process is important too, and that could really dictate how they react to your issue. Get to know the issues, the policy platform of the organization that you are working on behalf of. Know the history, the background, the recent events. Is there a bill number, or is it just draft, or is the issue you're talking about a rule change or an existing law? So it's kind of important to know where in the process, if you're advocating for a certain bill, how far is it advanced in the process? Has it passed a chamber? It really goes a long way to helping them piece together, kind of what the next steps are. Because a lot of times the lawmakers, they're thinking about the merits of the issue, but they're also thinking about the process. Okay, so where is that? Is that just sitting in committee? Has it had a hearing? They kind of want to know all those things, and that kind of helps inform whether it's something they should be paying attention to or not. Review your talking points and messaging. I think that kind of goes without saying, but it's really important to be succinct, and brevity is everything in advocacy and lobbying. Just trying to get to the point as I go on for an hour here. Trying to get to the point quickly is critical. And as I said, their bandwidth is limited. They're having people coming at them left and right. So if you get to the point quickly with really succinct points, that's a very effective approach to take. And the most important thing that I always find effective in advocacy is reflecting on your own position and thinking about how you're going to tell your story. If you have a story that relates to the issue and you can provide kind of that anecdotal support, it's just everything in really having success in reaching that person on a personal level. Because if you're just one-on-one and you're able to kind of get to their heartstrings, pull at their heartstrings, or speak to them as person to person, rather than kind of talking about laws and not warm and fuzzy things, that tends to resonate much more. So executing meetings, dress code, flexibility, punctuality, these are all important things to keep in mind. I mentioned brevity and staying on message, but also, making the ask. What are you there for? We would like you to support this. We would like you to ask the chairman for a committee hearing on this bill. So just being very, very to the point, or if there isn't an ask, if it's just a, look, I'm just kind of trying to get to know you, get you to know our organization, that's fine too, but just being very specific in the purpose for why you're there is helpful. And then, cultivating the relationship with the lawmaker is so important. As I mentioned, if you go in one time or you make one phone call or send one email, it's certainly, any touch point is always helpful. And everyone's busy, and I'm not going to say that it's a wasted effort. But if you can continue to kind of do the follow-up and attend the meetings and really get involved and cultivate that relationship so your lawmaker knows who you are, that will really go a long way in helping you. The next time you want to pick up the phone, there's something that popped that's really problematic, and you can just send off an email and they know who you are. You can call them or attend one of their local meetings. they know who you are, they will respond to you. I do find that lawmakers, particularly lawmakers, I would say House members, but Senate too, they're very responsive to their constituents and the constituent issues. So if you're able to connect back in the district, that's key. Continuity is certainly key. So I just wanted to do a little thought exercise and kind of think through, based on this presentation, what steps are you going to take to become an advocate if you aren't already one? How interested are you in all of this, and what does success look like to you? You think about all of the issues going on in the world right now. There's so much ground to cover, so much advocacy to be done, but each individual has things that they care about and priorities that they have. So I think reflecting on if I want to start advocating, what does success look like, and what if I'm working on behalf of the ARC, what within the ARC's policy platform do I really feel passionate about, and I want to start working back in the district or in Lansing or whatever's feasible for you. And then have you thought about seeking office yourself? I think I mentioned the best advocates are those with lived experience or have a deep felt passion for a cause, but those people also make great lawmakers because they bring a valuable perspective to the table in Lansing. So considering running for office, if you do have that passion and interest, I would encourage anyone to look into that. And then just wanted to share some resources that I find very helpful as I kind of educate myself about Michigan advocacy and government and politics, and kind of and really, if you want to get into the weeds on some policy issues, some of these resources are really great, and I know that they're included in your handout. With that, I will entertain questions.
Thank you so much, Kristen. Our first set of questions has to do with the legislature. So if I want to contact my representative, where can I find a list of their emails?
A lot of them have them just on their website. If you go to their contact information, sometimes you can just, if they don't have it, it will depend. Sometimes you can Google it pretty easily. I mean, all of their emails are pretty public information. They don't keep that hidden. But generally, Betsy, they're on their contact us page on their website is what I found.
They're very easy to find. The legislative website generally, I think, is very easy to navigate, so you should not have trouble finding that at the legislative website. I also would just point to the Michigan Citizens Guide to State Government, one of the resources that Kristen included in her presentation that has all that information and more about your legislators. So both excellent places to go for that basic contact info.
Perfect, thank you. At the federal, this is the next question. At the federal level, I'm used to working with the professional staff members. What is the difference in staffers at the state level versus the local level? For example, how much weight do they hold and how accessible are they?
I think that staff carry a lot of weight, particularly with term limits. The staff oftentimes have more experience than the lawmakers. They've been there longer and they're more embedded in the system. A number of staff will kind of jump from lawmaker to lawmaker if, as they funnel through their terms. So in terms of experience and carrying weight, generally staff do. I mean, there's exceptions, but and I do find them very approachable and very easy to reach and access. So I would defer to Betsy on
No, I just would, reinforce what you've just said. The staff are smart, they're energetic, and in most cases, they really are a gatekeeper to the lawmaker. So any time spent developing a relationship with staff, and educating staff about the issues you care about is always time well spent. It will get back to their bosses. That's their role. And I would just say this to the point of Michigan's stringent term limits. When people have such limited time in office, the pool of candidates has to get replenished all the time. And what we often find is that staffers aspire to their bosses' jobs once their bosses are term limited out. So there's value in the current time for those relationships, and also a lot of times that will pay off when those staffers move on to influential positions of their own.
Thank you. Our next question has to do with absentee ballot applications. And I'd just like to remind everybody that next week we have Mark McWilliams from Michigan Protection and Advocacy Service here joining us to talk about voting. So the question is, I heard absentee ballot applications were being sent to everyone. Do you know when I can expect to receive that?
I just got mine this week. I don't know about you, Betsy. Yeah,
I did.
So I would assume shortly. I can only speak from personal experience. I do know they're being sent to everyone. So I would think in the next, week or so.
Thank you. The next couple of questions have to do relate to the coronavirus issues. So about the direct care worker wage issue, what is the source of the temporary $2 an hour increase that Governor Whitmer announced on April 23? Is this CARES Act money or state money?
So the one that that Governor Whitmer proposed is mostly state money, is my understanding. I think that there's still some clarification around whether any federal dollars will go to that. But the legislature is also proposing a larger increase of $3 an hour through the remaining fiscal year, and that will be entirely federally funded. So the current increase, I believe, is a mixture of state and federal money. But the proposal before the legislature will be entirely federally funded. And there is some friction over, what the funding stream looks like. So I think it's still a little unclear in the end, how that expenditure is going to be made and what funding source is going to be used.
Thank you. The next question asks, do you have any update on the status of State Bill 690, which is the direct care worker $3 wage increase?
Yes, so just for those who aren't aware, this is a supplemental appropriations measure that it was $500 million when it passed the Senate, entirely federally funded through the Coronavirus Relief Fund. The House in the last couple weeks has made a number of changes to what passed in the Senate, and it's actually double what the Senate had proposed or what the Senate passed. It's now over $1 billion, is my understanding, with even more of an increase for direct care workers from $178 million to a $226 million pot. So the House made the package bigger. The House Appropriations Committee passed it this week. It was supposed to go through the full House this week as well, but it's on hold right now. And my understanding is, there's some negotiations potentially with the governor and the Senate over what the final package looks like.
Thank you. The next question If someone was discriminated against while trying to access care via Medicaid, per the governor's executive order related to COVID-19, how would a person file a complaint?
Betsy, do you want to?
I don't specifically know the answer to that. My initial thought is that that would be a complaint handled through the Department of Civil Rights. But I truly don't know. So I don't know what the mechanism is, Emily, for getting a response and sharing it back to this group. It's an excellent question. I don't want to misspeak. I'd like to find out and get that answer back to everyone.
All right, that sounds like a good plan. Thank you, Elizabeth. Next question. I watched the town hall the other night, and Representative Huizenga said that he feels the CARES funding hasn't been spent and doesn't understand why it's not. If there's money available, do you know why this hasn't been spent?
I can only speculate, and I know there's been a lot of scrutiny around this. The governor was actually testifying before the U.S. House Energy and Commerce Committee this week in Congress, and Representative Tim Walberg was asking these same questions. So I know the congressional delegation has flagged it. My understanding is that they're still trying to seek the administration, the governor is still trying to seek some latitude with the use of that funding to be used, not for what it was initially prescribed by Congress to go to potentially backfill some of the revenue losses that I mentioned. We have a $3.2 billion hole for 2020. I think that, they're looking at how do we ward off these deep cuts, and they would really like to use some of that CARES money to backfill the revenue losses. And they haven't had clear guidance from the federal government yet on whether they can do that. And so for now, I think they are holding some of that money until they have more clarity.
Right, thank you. There were a couple questions looking for your contact information, and I just want to remind everybody that the handout or the presentation that you just viewed is available in the GoToWebinar control panel under the tab that says handouts. So if you click on that, it'll open on your end, and then you can save it or print, do what you would like. So the last question that I have available right now is, can you recommend how to find a strongly established advocacy group across the state?
Oh, well, I guess
besides the ARC, you mean?
Yeah, I mean, obviously it depends on the issue that you care about. The ARC is the best of the best for advocating for individuals with intellectual and developmental disabilities and the issues that touches. So I would point you to the ARC for those issues. I went through their policy platform, but it would really depend on the issue. If it's your interest is environmental or civil rights, it really would depend.
Thank you for that. And in the GoToWebinar chat box, I posted the link to the ARC Michigan website where you can find if there's a local ARC office near you. So that's another way you could make a local connection. All right, that is it for our questions. If somebody has follow-up questions after this webinar, they can contact us at info@arcmi.org. So thank you, Kristen. Thank you, Betsy.
Thank you.
And, thank you, everybody, for attending this week's Disability Policy Webinar Series presented by the ARC Michigan. Come back next week, Friday, June 12th, when Mark McWilliams from Michigan Protection and Advocacy Services will be here talking to us about voting. Thank you, and have a good day, everybody.
Bye-bye.
Bye.